Is that okay?
Okay, well, live.
Premi ma'am?
Yep.
Yeah, so whatever slide
Ye-
Soumya would be showing, I just click a picture of that slide and then I'll send it to you on WhatsApp. So you'll know what to talk
Yeah,
about.
perfect. 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 That will be perfect.
Okay. Okay, we are live. We can start.
Good afternoon, everybody. I hope you all are doing good and taking care of your physical, mental, and spiritual selves. This is Ved Vyas Gujjar, and I, along with Mr. Om Gaike, are going to be your host for today's session. It fills my heart with immense pride to be a part of the Sydenham Rotaract Club, a place where we try to make the world a better place by evaluating ourselves as individuals, by making the right choices and standing for what is true. This is our first event, and I, on behalf of the entire team, can assure that this event is going to get us a fraction closer to our shared dream. Now, November 7th. It might feel like a very obvious day to you, and we might do some very regular things, and this day might go away in a very predictable manner. But hey, not this year. Guys, please bear with me for some time. Now, I would like to take you a few years back when this day gained its importance. Back in 2014, when the Union Minister, Mr. Harshvardhan, or should I say Dr. Harshvardhan, was the Union Minister for Health and Family Welfare, announced this day as the National Cancer Awareness Day. Yes, guys, in 2014 was the day when was the year when this day gained its importance. Now, as this name is quite self-explanatory, its main motive is to generate awareness among the people about the symptoms, about the disease, and the small lifestyle habits and changes that can contribute to a long run. Today, the Rotaract Club of Sydenham College takes this day as an opportunity to fulfill its duty towards the society for creating awareness and breaking the myths about cancer. In fact, Siddhartha Mukherjee, a renowned Indo-American physician who is also a oncologist and also author of his book Emperor of Maladies, has proudly said that to confront cancer is to encounter a parallel species, one perhaps more adapted to survival than even we are. Well, his words seep deep into our mind. When we see all these alarming figures, it just blows our mind. I know that. Yeah. In fact, every sixth death in the world is due to cancer, making it the second largest cause for death in the world. Well, it's high time that we speak about it and we educate ourselves, our loved ones, and our friends about the disease of cancer, and we take some important lifestyle changes. To guide us in this session, we have two speakers with us today. Both of them have immense knowledge in the field of cancer. It brings me immense pleasure to have such great personalities with us today. They are Dr. Ian Pinto, who is one of the top oncologists in Mumbai, and Miss Premi Mathew, who is the founder of the NGO Hair for Hope, and in fact, she is also a cancer survivor. Yes, guys, you heard me right. Um, Ma'am, is there anything you would like to say?
Oh, well, I'm so honored to be with you people. You're doing an amazing job of creating awareness. And yes, Hair for Hope India is run entirely by students, and it's great to have you on board. Thank you so much for inviting me.
Thank you so much, ma'am. Sir, is there anything you would like to say to our audience?
It's great to see that from such a young age, you know, students involved in spreading the message of awareness to everybody, and I think that's the key here: spread the message of awareness, because prevention is better than cure. So
Very
that's
true.
great to see that you guys are taking this up.
That is just good. Thank you so much. Guys, before we go much deeper into this session, there's someone that we all would like you to meet. This brave little young kid is here to set an example in front of us. His name is Arham. He stays in Dubai with his parents. He's 4 years of age. Can you believe that? He's 4 years of age, but his dreams and aspirations are huge. He has been growing his hair since the last 3 years, and today he is here to donate his hair to cancer patients. Now, little big Arham is going to donate his hair live on the spotlight today. Arham, the stage is all yours. Please go ahead.
Hi everyone, my name's
Hello, Arham.
Arham.
Hi.
I'm 5 years old and I'm growing my hair to cancer patients because sharing is caring.
We started growing his hair since from he's a year old. Uh,
when we started growing his hair, people used to get confused whether he's a boy or girl. Actually, this is the inspiration. We got it from my wife's friend. Maybe
Yeah,
he can tell them.
she is a cancer survivor, and because of her, I got this inspiration because I have seen her losing her hair and losing her self confidence. But she now she is very pretty well, and she is doing well. And today we are going to finally the day has come after long wait. So let's start our donation.
Can you say?
Yes.
And we are really grateful for Premi Mathew to giving us this opportunity and this platform too. Thanks to Yash and his team, entire team, and thank you, Doctor, for joining us here.
Thank you so much for doing this.
Let's start.
Okay. Okay. Yes, Aram.
I'm
You
extremely proud
can
of
go ahead.
Farham. Yeah, start cutting, please. It's
Sorry.
really beautiful to see you. And I must add that in Dubai, it gets very hot, and people do bully kids who grow their hair because he's a boy. People get confused, but it's a lot of determination, a lot of perseverance, and he's setting an example for all the students anywhere in the world by growing his hair so long and waiting till it's 12 inches. 12 inches is a required length. So inspiring not just Mumbai, not just Dubai, but probably the world today. And I'm really proud of him. He's already been on ZTV and all the newspapers here.
I am already so
Great.
scared. Thank you.
Lovely.
That's one.
So that's how you cut it. You tie it first. It has to be absolutely dry because moisture can destroy the hair. That's very important that it should be dry. And this hair will be used to make wigs for cancer patients. In fact, you'll be giving it directly to one cancer patient one of these days. Yeah. Can you post with that?
I think you should get a good clap there. So thank you for doing this. Such a young age. Brilliant job. Brilliant job.
Congratulations, Arham. I'm so proud of you. I can't describe how proud I am.
Thank you.
Yeah, we love this. Thank you so much, everyone. Special thanks to Miss Premi Mathew for this, giving us this support.
Special thanks to the team there.
Yes, always.
Thanks for this platform.
It is a beautiful platform.
Yes.
Thank you.
Now you will have a good haircut, right?
Yeah.
Yes.
Arham, you want to say anything?
I am very happy and I'm excited.
He's very happy and excited.
Yeah.
Thank you. You'll find a story on the page, Hair for Hope India.
Arham, what you have done today is extremely courageous and selfless. I think you're a little too young right now to understand that what you have done today. You have set an example. You are an example today in front of so many people. You have truly motivated us and inspired us to do something so great. On behalf of everyone who is watching this, I would like to thank you and I wish you the very best for your future life.
Thank you so much.
Thank you so much.
Yes.
Thank you so much.
Yes, sir. Yes, ma'am. I believe Om has some questions for both of you, ma'am, doctor. Om, you can take over the stage now.
Thank you so much, Ved. Firstly,
all the
ma'am, doctor, it's an honor to be speaking with you both. I have some questions for you. Firstly, ma'am, what difference do you feel pre and post being diagnosed with cancer?
Could you repeat the question, please?
What difference do you feel pre and post being diagnosed with cancer?
Oh, I must say, if I've done anything with my life, I used to work as a faculty. I used to teach marketing for 25 years. But I would say what I've done creating Hair for Hope India is something I can be really proud of. I mean, 25 years, money is not the only thing that counts in life. Imagine a moment like this when a 4-year-old grows his hair for 3 years to donate in this sweltering heat when girls chop it off for no reason. So I would say my life has become much more meaningful after cancer. It's all for a purpose, I believe.
I'm sure. So, what do humans go through during the phase of cancer on a mental, physical, and emotional level?
Well, losing hair is the most horrible part of chemotherapy, and that's why it's important to tell people not to throw away hair because hair means the world to a chemo patient. And that's what Arham has done today, show the world that a 4-year-old can also help a cancer patient. It's not just money which you can give your small things like your hair, and that's why I'm so proud of him.
It's really inspiring, to be honest. So can you can you tell us how can we talk and extend our compassion to the ones in a similar journey and show us support?
Oh, what you can do is, like, for example, when I was going through chemotherapy, my husband is working, my daughter's in India studying, and I had this friend who used to take me to the hospital to get me breakfast in the morning because cooking is a problem. Just small things like that, transport me to the hospital, sit with me during chemotherapy, and these are things which any student can do there. Give them your time, look after the children, for example, if you can. So instead of that, in India, I don't think people do such things. We need to go for so many tests, for which we need people because our husband can't take leave because we don't get that many leave. So these are
Yeah.
things anybody can do, and that's what you could do. Become a chemo buddy, in fact, to the patient.
All right. Something to take note of. So, ma'am, you've been awarded various international awards for your movements, and so can you tell us your story? Like, what motivated you, the difficulties you faced, and what you achieved at the end of the day?
Oh, I guess I saw this boy. He's my nephew. I think I'll go through the PowerPoint because I can show you the boy also.
All right.
So I had this nephew who grew his hair for 6 years to donate, and that's what inspired me because in India and UAE this was unknown concept. No one knew about hair donation, for example.
Mm-hmm.
So that's why it's so important to create awareness. And I learned it from another 6-year-old boy, as I said, my nephew, who grew his hair to donate. So, well, I think I'll just go through the slide one by one so that I can show you the boy also, so that you can see him also and how he inspired the world
All
by
right.
just growing his hair to donate.
All right.
So I started this movement called Protect Your Mom campaign because lakhs of people are dying every year just because of ignorance, which is ridiculous in this age because a WhatsApp message can reach the world in a minute. So that's why I started a campaign called Protect Your Mom campaign because in India, the awareness about self-exam is very low. So that's what we'll be talking about today. In fact, it's called Protect Your Mom campaign, and I've made a few pictures so that you'll understand it better. So we'll look at it one by one right now. The Protect Your Mom campaign is something any kid can join because it's all about creating awareness about self-exam, and the doctor will explain how to do it. It's something you can do at home, at your own house, and find breast cancer early. The reason why I'm here today is because I found it at stage 2. Stage 2 means it hasn't spread. And once it spreads, that's when cancer becomes terrible. So that's why I'm here today to warn all the ladies to find it early because early detection is the key. Before cancer spreads, if you find it, then it's very easy to treat, as the doctor will tell you. And and then, as you can see, I'm absolutely fine now. And I feel it's the duty of every child to make sure the mother checks for the early signs. And that's what this campaign is all about. So we'll look at it slide by slide. And I'll explain as we go on. Could we start with slide 1, please?
All right. Soumya, could
So,
you share the screen?
so before we start, as we talk about, while she loads the slide, this campaign is run entirely by students, and that's how we started in 10 years ago. I was down with cancer, as I told you. I was teaching marketing at a college here. I used to teach in India also, by the way. So I, in fact, started my career with Welcome Group College in Manipal, in fact. So this is the first poster we made, and I really need people to design more posters to create awareness about this horrible disease, which is killing millions of people around the world. And you can put a stop to it by just creating awareness. So this is the first slide. This is the first poster we made, just me and my daughter, and that's how we started. Go on to the next slide, please. It's all about protecting mom, a simple thing which everybody needs to do. Next slide, please. So as I said earlier, my cancer was at stage 2. Stage 2 means it hasn't spread. Cancer spreads very, very, very fast. And once it spreads, that's when it goes out of control. So that's why it's important to find it early. As you can see in the slide, well, stage 2 means it hasn't spread all over the body. So if you find it at that stage, the doctors can kill it before it kills. Next slide, please. So here we see an 85-year-old running a marathon because she's absolutely fit. The next slide, please. The 85-year-old lady. So here we see 85-year-old running the marathon, showing that nothing will happen to you if you find it early. Go on to the next slide, please. So next slide, please. Okay, I think we are having a little technical problem. Give me a minute, please. Okay, that is an 85-year-old lady who is running the marathon. Next slide, please. Okay, so these are the signs you need to find. One of my signs was a tiny little painless stone. It's like a stone in the breast. So my husband is a doctor, so he said it's cancer, and I didn't believe him because there was no pain, nothing. So
Could you please go to the next slide?
what you need to do is you should
about that.
search every month for the early signs.
Yes, the
Running the
92-year
marathon.
cancer.
Next slide, please.
Yes.
Next slide, please.
Soumya, could you
Okay,
please
so
change the slide?
So the doctor will explain how you need to search for the early signs, like a lump in the breast. It's like a tiny little stone. And that's something every lady should do every month while taking a bath. So go on to the next slide. Next one, please. Sorry, I think we are having a small technical problem there. Next one. So it's pretty easy to find it. And I think they can send you this picture to all of you so that you can check for the early signs. What you do is, while taking a bath, mothers would make atta. That would be the next slide. Could you change the next slide, please? Is there any problem with the next slide? Is it coming?
Ma'am, it's on, yeah.
So, could you go on to the next slide? I'm sorry about the technical problems. But basically, like when she makes atta in the evening, imagine she's making this atta in the evening. Every day she must be doing it. So imagine your little brother puts a little stone in it. Imagine naughty little brother puts a stone in it. How will you find the stone? As you know, you'll touch it, you'll press it in various ways until you find the stone, right? So that is what every mother should do every month. Because, as I said, if you find it early, the advantages are many. Next slide, please. So touch every month, check for any stones. Next slide. Um, Next slide, please. So sorry about the technical problems. Okay, now these are 7 survivors, actual survivors. So in India, there is a concept that, once you get cancer, you die, that it's the end of the world and things like that. So I held this event in Dubai and also in Cochin, wherein I had 7 cancer survivors. Look at them; they're gorgeous, right? Can you zoom into the picture, please? You'll see that they're looking absolutely gorgeous. Just to dispel the notion that once you get cancer, it is the end, is what people believe in India. So it's not like that. Anybody can look gorgeous, anybody can live a life of their own. So, doctor, I must say that this is the essential first stage for a cancer patient, because when you are diagnosed with cancer, you think that's the end. But it's not really the end, because if you see a picture like this of ladies looking strong and gorgeous and beautiful, you know there is life after cancer. And that probably is the best first aid you can ever give a patient. And you'll find all these stories of all these ladies on my page. Next slide, please. So all of you can, if you know any patient, you can show them the stories of ladies who beat cancer. If you go to my page, which is called Protect Your Mom International. Next slide. It is to dispel the notion that there is. I mean, we believe in fate and karma, and we think that it's all God given and all those things. But it's not like that. We can find cancer early and kill it before it kills, and that's what the whole thing is all about. Next slide, please. Could we move faster? Next slide. Is anyone changing the slide?
Just,
Okay, so that's my friend. That's my
just want
friend
to
Linda.
add that it says mammogram saved my life. It's very important. I'll come to that, but very important message here.
Yeah, exactly. So this is my friend Linda. She found it early, very early, because she did a mammo, and that's why she didn't need chemo even. So that's the most important thing. If you find it early, no chemotherapy. That is enough reason to do self-exam every month. Go on to the next one, please. If we do the slides a little faster, please.
Ma'am,
Next
you've changed
slide.
the slide. We're on the why is it important to find early suffer less. We're on that slide.
Pardon? Could you
Why is
send
it
it to me?
important? We are on that slide right now.
Oh, it's not possible. I'm sorry, I can't get you.
Why is it important? We are on. We currently on that slide.
You were sending the slides, right? Okay. So this is
Yeah.
Frida. She is a stage 4 breast cancer survivor, and as you can see, she and I did the chemo together. She was also a patient along with me, but she's still continuing on chemotherapy because after 10 years, she still has to go through chemo because she's a stage 4 chemotherapy. I mean, she's a stage 4 survivor, which means it's horrible, cancer spread. And that's why she has to go through 10 years of treatment while I finished in 6 months. So that is a difference. And that's why you must make sure your mother checks for the early signs every month. It's that important. But she is a very strong lady. She went to Antarctica a year after chemotherapy. She's a very strong woman. But the point is, it's very, very difficult. And this is Angela, another friend of mine. She looks bald. She's beautiful. But the point is, well, for a lot of Indian ladies, losing hair is the most terrible part of chemotherapy. You feel like crawling into a hole and not coming out. Now, she can face society, but for a lot of women, it's not like that. And that's why I started this campaign called Hair for Hope India. Next slide, which is all about creating awareness about hair donation. Next slide. So, hair donation is what he did just now, Arham did just now. And And the point is, this can help a lady face society with dignity. I'm not going much into this slide because it's all about junk food versus good food. Junk food is really bad, as you know, very bad for health, whereas whereas fresh green food is always good for any disease. It's important. Um, Next slide, please. Go on to the next slide faster. So this is what I do. I have events all over Dubai and India, in fact, to create awareness about breast cancer. We have students, and this is one of my favorite events where the students um, took small messages to their mother to tell them, to warn them to do a self-exam. So the school had an art and craft um, hour wherein every child gave a personal message to the mother. Now, this is much more powerful than the doctor's message because people don't really, may not listen to doctors, unlike the children, which are very precious to them. So that's why this is extremely important. And statistics are horrible. It's like 1 in 8 ladies, as you can see. This poster was made by a kid, and as you can see, 1 in 8 ladies end up with breast cancer. So it's very important to create awareness about early detection of breast cancer because anyone is at risk. I didn't have family history. I didn't have, but I still ended up with breast cancer. So statistics is 1 in 8 ladies. Tell your mother it's not fate and karma and God and all those things. It's about you taking care of yourself. So spend about 5 minutes today. Make her do a self-exam. Ask her to Google how to do a self-exam. Make her do it, and then make sure she's safe. So this is another poster created by an artist of mine, and it shows how important the mother is to the family. So imagine something happening to the mother. And by the way, I really need artists who can create images from my description. So as you can see, the mother is the center of it. And this is my family. 10 years ago, this was an impossible dream for me. I never thought I'll be alive to see my daughter's wedding. I never thought I'll be alive for 5 years. I never thought I'll be alive for 10 years. And now I'm a grandmother, and I'm so happy to the fact that my husband is a doctor, because otherwise I would have ignored it. There was absolutely no pain. I could hardly feel the lump. And so I invite you to join Protect Your Mom Challenge, which is all about you posting a picture of you with your family, hashtag it Protect Your Mom Challenge, and then invite others if you want. And of course, you can say something nasty to cancer, like don't mess around with my family, because my family is important to me. So that's what this challenge is all about. And I would like you all to post pictures like this. This is my favorite story. This is my what shall I say, a story of a lady who is alive because of Protect Your Mom campaign. Because the small one, as you can see at the bottom, she's only 8 years old. She was so upset when her mom lost her hair that she went bald. And the taller one, the red girl, she was in Delhi private school, Dubai, and she knew the Protect Your Mom campaign. And also, when her mother found this lump, she pestered her mother to go to the doctor. And unlike Indian ladies who always ignore it, she had to go to the doctor, and she's alive today because she found it early. So that's how important early detection is, because it will shatter you if something happens to your mother. So that's why it's so important to find it early. And this is how a typical lady looks during cancer. No hair, no lashes. Again, it is done by an artist. I really need artists. Really need videographers. I really need movie makers, because this campaign is not run by, it's run entirely by students. And I'm so proud of it because there's nothing commercial about it. And as you can see in the second picture, well, it's a dream for a lot of kids. And that's Dylan, my little nephew, who grew his hair and that's why we are here today, because he grew his hair just to donate, because he saw his girlfriend doing it. And although he was bullied, even in New Jersey, he's from New Jersey, no one knew about hair donation in UAE and India. So he's from New Jersey, and he inspired me to start it because I'm an MBA and I used to teach marketing. And if he can do, a 6-year-old can do so much for cancer patients, I should also do something, is what I thought. So this is how you donate. It should be tied at both ends, as like you saw in the beginning, because unless it is tied, it can get tangled and become useless. Also, chemically treated is fine, provided it's not very brittle, and provided it's not blue and green and yellow and all that. So long as your hair is black or brown, and so long as it's not very brittle, it is absolutely fine. And make sure it's totally dry, because if it's not dry, it could catch fungus and then it could end up in the bin. So that's, you should be very careful. Next slide, please. So you need to be, um, and this is a new initiative I just started about 2 weeks ago. You can give directly to a cancer patient. So doctor, if you know any patients, you can ask them to connect with me directly. What I do is I connect them with 5 donors, so that they can make a wig on their own. So funds have been a problem, because we need to pay the wig maker. But in this way, I manage to surmount all the problems, because if, for example, your friend needs a wig, I can connect them with 5 donors. We need 5 donors to make a wig. And then she can take it to the wig maker and convert it into a wig. Wig maker also will inform you. So all you need to do is take it to the wig maker and get the wig and give it directly to the patient. And I can tell you, it's a beautiful experience to give it directly to the wig maker. Directly to the patient. Of course, that's possible only after Corona, but well, you can do it later. But you can meet her on WhatsApp. That's what I do, and everybody knows where the hair went. I must add that although I started hair donation 10 years ago, now there are a lot of frauds happening because people are misusing it to make money also. So this way, you know exactly where your hair went. So you just try to contact me, and I'll connect you with 5 donors. So so this is Shalini, and she was the first to support me, because in India people don't talk about cancer. You don't even reveal the fact, and even the doctors, I'm sorry to say, were not able to understand why a cancer patient needs hair. So she was the first to support me. She dared to tell the press boldly, with her bald photo, how people treated her when she was bald. In India, the problem is very severe. You wouldn't dare to go out. You may not even face society. You might even not have the courage to fight the disease. So that's why hair is so important to a cancer patient. So she was the first to support me, and again I must add that she had to suffer for 8 years and finally lost the battle because it had spread all through her body. That's what I'd like you to do. I have volunteers all over UAE and in India, in fact, to tell the salon how to cut the hair. As I said, if you just cut, it's of no use. But it has to be dry. It has to be tied at both ends. So that's very important. And she was one of my first volunteers 10 years ago. Next slide, please. So anybody can volunteer from anywhere in the world, because so long as people cut hair, there is scope for you to work. Next one, please. And I have an army, in fact, of children as young as 9 running this campaign. And this is what I would like you to do. So as you know, people may not listen to long lectures, medical lectures. So what I do is we have dances, songs, and skits to create awareness, because that's much more interesting for you also. So I'd like you to, if you go to the page, Protect Your Mom International, you'll find a lot of dances, skits, wherein they talk about losing their mother because it's too late, and how you could have saved your mother if you had made her do a self-exam early, which is the thing we're communicating basically through dances and songs and skits. And you can send me, in fact, we are having a contest right now in India. I've sent the poster to them, and they might be circulating it. So you can also send me dances and songs, because I think music is much more powerful, and dances are also much more powerful. You'll find a lot of them on my page. Next one. So be the next to create awareness and save a life. And you can even win some prizes also. It's a big contest which is going on, and you can find it on my page, which is Protect Your Mom International again. So these are some of the events we had. I had events in all over India also, with a lot of clubs. In fact, I join with clubs and have a lot of events. And she's one of my youngest volunteers. You see down. She's only 9. She went and held an event in Idiki. These are three important people in the campaign. One is Aditya, the first one. He was the first to design a dance to create awareness. So he lost his grandmother to cancer. So what happened was he makes his mom check for the signs every month, because he knows that cancer can take away his mom also. And what's more special about him is that he won 60,000 dirhams, because we have the Sharjah Excellence Award and Hamdan Award, and that's 12 lakhs, and he donated the entire 12 lakhs to charity. So he is my, what shall I say, one of my favorite PYMers. I have brand ambassadors in so many schools and colleges, and you could be the next one if you'd love to be. And that's Kartika, the little one in the girl. She was one of my first volunteers. She's only 9. She went to Kerala, one part of Kerala, and did an event there. And when you hold an event, instead of cutting your hair in a salon, when you cut in front of a school or a college or a club, your kids creating massive awareness. So that's how we work. That's my page, Hair for Hope India. And please check the page for all the stories. You'll find so many survivors. And doctor, you could use this, because if a patient comes to you thinking that her life is over, you should show people there, a lot of survivors there who have beaten cancer and are looking gorgeous also. I feel, as a survivor, I feel this is the most important gift you can give the patient, the first aid you can give. And this is my dream project. I don't know whether it'll ever work. But in Dubai, earlier, we could, in schools, they used to have this, sale and all that, bake sale and all that. So it's just 10 dirhams, 20 dirhams, 100 rupees there, for example. Collect 100 rupees from everybody in the school, give it to a chemo patient for one treatment. At least it's one therapy. So it sort of, makes them understand the value of 100 rupees, number one. It builds values in them. It saves a life. In fact, these people save that life, because she didn't have money to pay the doctor. She didn't have money to get discharged from the hospital. So these kids, they took that money and helped, it stays alive. So I think that's something Rotary clubs can do, small things. And because you're students, let me conclude by saying that nothing is impossible. If I can start a campaign which is global now, I mean, we're not just talking about Dubai or India, we're talking about Muscat, Pakistan. It's spread all over the world, in fact. And it's still run by children. So nothing is impossible. And I believe that, as you know, it was horrible 10 years ago. I never thought, I was a shattered mess, I must confess. No hair, no lashes, no eyebrows, looking horrible. But if cancer hadn't occurred at that time, I probably wouldn't have started Hair for Hope India. And if I'm proud of one thing in my life, it is Protect Your Mom campaign and Hair for Hope India. So nothing is impossible. Stay strong, and I'm sure you can surmount anything. Thank you so much for inviting me here, and I hope technical delays were not a problem. Can we go to the
This
doctors
was
now?
really inspiring, ma'am. Sorry.
Yeah, thank you so much for inviting me.
Yeah, ma'am, it was really inspiring and eye-opening. This is for the viewers. If you guys have any questions, feel free to comment down or in the live chat. Um, let's move on. Ma'am, I have one last question for you. Can you tell us how students can contribute to this cause?
Oh, my students run the course. So, for example, if you're doing marketing or PR, you can, in fact, it started off as a marketing project. So, you can organize an event in your college. You'll find all sorts of events on the page, organized entirely by students. It builds your leadership skills, it builds your communication skills. If you want to apply to a good university abroad, all of them have ended up in top universities, in fact, right from MIT, USA, UCLA. I mean, my students have placed in the best because they show their leadership skills by organizing events, and it's all documented. So they know then I'm not telling a lie when they say that they organize an event, because there's a TV coverage, there's a newspaper coverage. So they can always substantiate the fact that they have leadership skills. And I would say the employers are also looking for these skills: leadership, communication, teamwork. These are the things they look for, not just mugging up some, I'm sorry to say. So it's very important that you join this campaign, and you can organize an event anywhere. It could be small event. It doesn't matter. Thank you once again.
Surely, ma'am. Doctor, I guess I believe you have you have something to present.
Yep. So I've
You can go
shared my
ahead.
screen. I hope you can see it.
Yes, yes, it's visible.
Okay. So, hi, lovely to hear your story. So, the first thing before I start is, I use a sentence whenever I tell any patient is going to get chemotherapy. And I always tell them, you're going to lose your hair, but you're not going to look like me, 6 or 10, a year later. And I think you're a testament to that. You look beautiful. The hair's all back and there. So thank you today for talking so much about hair because it is truly very, very important for women. Out of all the side effects of breast cancer, I feel hair loss is one of the toughest things, for them, especially in India, where there's a lot of social stigma. So it's great to see such a great champion, in getting hair for these patients, and also a post, a post treatment when you've shown all those beautiful ladies who've gone through chemotherapy, and who have survived and battled cancer. I think it's amazing. I know that you didn't get chemotherapy, is what you said,
No,
but
no, no,
I
I
definitely
did.
saw the. You did.
Sorry,
Okay, then great. Yep. So
6
yeah.
chemotherapies.
Okay, so looking good after that. So that's what I'm trying to say. Thank you for sharing that message. A lot of people have a lot of doom and gloom, especially when they, hear the word cancer. And this talk, basically, we've been doing it across Bombay, across India. We've done it through the Indian Cancer Society. We're translating it into regional languages so we can communicate prevention. I've done all my training and practice in the US at centers like Memorial Sloan Kettering, NYU in Columbia. And then we came back here about 6 years ago. I think one of the biggest messages is to connect to the people to understand more about prevention, rather than seeing late stage disease. So let's go through this and let's hope that I keep it very simple and, so that we can all get it. So, the biggest question, when anyone has a lot of fear, the biggest question is to understand what the disease is so that we can conquer that fear. And the first question is, what is cancer, basically? And cancer is any change in a cell, any mutation or change in a cell, and it starts producing more than the surrounding tissues. So you can see automatically, you form a lump or a bump because it's growing more than the surrounding tissues around it. Now, this is the world map of cancer incidence, okay? And top line here is Australia. You can see America. You can see all the developed worlds are very high. And there's India, okay? And you see India's incidence in comparison to the rest of the world is actually low, okay? But then you look at this beautiful presentation that came in the Lancet. Now, this is 1990. The colors here, the lighter the colors, the less cancer. The darker the colors, more cancer, okay? And you can see 1990's map of India and see 2016's map of India. There's a dramatic increase, as you can see. There's darkness in every state almost. And this shows us that cancer incidence is increasing across India. So it's very important to get the message of prevention here. Okay, so this is why it's worrying. Um, the grim reality in India versus the rest of the world is that 80% of the patients, come very late. They come when nothing really can be done here, because they wait for the last minute, okay? And often we get a lot of excuses for that. It's my son's exam, 10th standard, 12th standard, cousin's wedding. I thought, let's finish the wedding, then I'll tell them about the lump in my breast, okay? So women are very self-serving and people don't really want to disturb the normal life to get themselves checked out. So it's
I'm so
very,
sorry, sir, to disturb you. Hello. The slide isn't changing.
okay. So, oh, you're not changing at all?
Yeah. So sorry to disturb you.
Sorry about that. What do you see? You see only the first slide?
Yep.
Should I try presenting it again? Hold on. Sorry for the.
Yeah.
Clearly Google.
Now the slide is changed.
Yeah. Okay. Now you're seeing the. Let's try this again. I think it's just staying on my presentation. So let's try to do this. Maybe we'll try this because I'm sorry I can't zoom in. It's not picking up the zoomed in presentation.
So this will work. This will work. It works.
Yeah, that should work better, I think. Okay. So I'm sorry, this is the map I was talking about. This is the colors on the left. You see very, very light colors. This is the map now with very, very dark colors showing the incidence of India increasing significantly. Okay. And so back to the grim reality. I was talking about 80% of our patients come here, last minute because no one's checking early. There's no prevention going on. And I told you for varied reasons, someone's exam, weddings. So we must first get to the doctor as soon as we can, moment we detect any problem. Interestingly, in India, 71% of deaths are between the age of 30 to 69. And, in comparison, in the US, 50% of those deaths at an older age at 70. So we're seeing younger people dying from cancer here. And our numbers are around 70% death for cancer in the first year because we get most cases very, very late. So, the next thing about cancer is what causes cancer. Okay, now the biggest problem about cancer is the stigma associated with cancer, because everyone believes that cancer is associated with families. The biggest thing is that if I tell anyone I have cancer, how will my daughter get married? Who would want to marry into my family which has cancer? So that's one of the biggest stigmas I've found here, especially in India, that no one wants to share that they have cancer. They don't want to get the support from around. Okay, and but if you look at it, statistically speaking, only 4% of cancer is actually genetically based. Okay, the biggest cause of cancer here is tobacco. Almost 40% of cancer is related to tobacco and tobacco-related products like pan masala, gutka. In fact, in India here, gutka, the cancers that we see come very, very young. They're really, really fast, widespread cancers from gutka. And even though it's illegal, we're seeing it sold across the country. So that's one of the highest causes of cancer. Now, everybody knows, especially during this lockdown, that, deliveries at home, either Swiggy, Scootsie, we get our meals, we get our pizzas, all the junk food that we eat. India's changing. No longer are we eating home food. We're ordering in, and definitely obesity rates are increasing. And obesity plays a big role in cancer. And I think almost related about 15% of cancers. Okay, we do have something like HPV virus, or the human papilloma virus, from hygiene and hepatitis B and C, also leading to some causes of cancer. And 25% of cancers we don't have a reason yet for. Okay, so we're still working on that. Now, I want to spend most of my time on breast cancer. And why is that? Because now the most common cancer in Indian cities is breast cancer. So, and it's also the most common cause of death among cancer deaths among Indian women. So it's skyrocketing with increase. Now you heard the previous talk, and it was about stages. Now, what is the stage of cancer? So whenever we have a cancer, we look at where has the cancer started and where has the cancer gone to. Okay, if the cancer starts in the breast and remains only in the breast, it's a much earlier stage. Okay, and an advanced stage, or a stage 4, means that it's gone from the breast into a distant organ, either to the lungs, to the bones, to the brain. So that is an advanced stage 4. Now here are two maps. On the left, these are the 4 main centers in India, and most of the cancers in India are diagnosed in stage 2 or stage 3. Whereas if you look on the right, this is the SEER data from the US. Most of the cancers are diagnosed in stage 1. Now, a lot of people might say, so doc, what's the difference? Stage 1, stage 2, what are you talking about? But when you look at incidence of survival, 5-year survival, and that's what we normally look at cancer survival, stage 1 cancers or early cancers have close to 100%, close to 100% survival. But when you reach to stage 4, an advanced cancer, that survival drops to 25% or lower. So it's very, very important to catch the cancer early. Now, that's why we are pushing screening in breast cancer. And what is screening? The goal is to find cancer when it's asymptomatic. That means you as a person do not know that the cancer is there. It's asymptomatic. So you catch it early. So if you treat it early, you increase your survival. And that's what we talk about screening. there's only one method that's actually proven to have a mortality benefit. That means it decreases your odds of dying by 20% is a mammogram. Now, I've tried to communicate this a lot here. You know, a lot of patients, a lot of people have a question about radiation, and the radiation is absolutely minimal. Now, what are the types of mammogram? You can have a plain X-ray, a film mammography, where you just have it like how you get an X-ray. You also can get a digital acquisition of that picture. And whenever we get a digital acquisition, sometimes the pictures are much better, especially in dense breasts. And nowadays, we come up with something called the 3D mammography to get a 3D vision of the breast so we can better diagnose this. Now, when should one get a mammogram? And I've just put, you know, there are a lot of guidelines across every country, and a lot of guidelines state very different ages. But as a ballpark, anyone between 40 to 45 years of age, women 40 to 45 years of age should get a mammogram every 2 years up till 74 years of age. Now, that said, in America, even though the guidelines say every 2 years, insurance pays for mammograms yearly after 40. So this is a ballpark standard. 40 to 45 years, women, you should be getting a mammogram at least every 2 years till 74 years of age. Now, every woman has a certain risk of breast cancer. You know, maybe a 5 to 10% chance of breast cancer, but that risk increases based on many factors. Now, everyone has heard of Angelina Jolie, right? I mean, everybody has heard of Angelina Jolie. Now, Angelina Jolie had both her breasts removed. It was the front page of every newspaper in America and including India, okay? And that was because she was found to have a BRCA1 mutation, a BRCA mutation. So we have two mutations, BRCA1 and 2. And if you have that mutation, you're a higher risk of breast cancer. Now, who should be worried about this BRCA mutation? When we find women who have breast cancer, you know, at a younger age, less than 40 years of age, or if we have multiple people, first degree members in the family, for example, grandmother, mother, daughter, all having breast cancer, and some having breast cancer less than 40, this must trigger a look for this BRCA mutation. Nowadays, in India especially, out of all the breast cancers, we have a type called triple negative breast cancer. This is one of the fastest growing breast cancers in India. And triple negative breast cancer in anyone less than 60, we should look for the BRCA mutation. Why is it important? Because it does not only affect women, even men in the family. So even the sons can have the BRCA mutation and get male breast cancer or prostate cancer. And I've seen BRCA lung cancer too. So it's important for not just women, also for men. So if you have a family history, if it's young, if it's a triple negative, I would think you should get your testing for BRCA1 or 2. And this also increases your risk for ovarian cancer. So very, very important to check. Alcohol, you know, taking hormonal therapies that, you know, with estrogen also have an increase in your risk. What decreases your risk for breast cancer? Breastfeeding for a longer period of time, more children, and, a fit weight. That's also being shown to have a beneficial effect on preventing breast cancer. So these are, few simple things we can do about breast cancer. Now let's switch to cervical cancer. And, cervical cancer was the number one cause of cancer in the United States of America. Now it's the number 7 to number 8 cancer. And there's only one test that changed that. And that's called a pap smear. It's a smear that you can get either through your gynecologist or in some places through your general practitioner. Who should get a pap smear? Anyone above the age of 21 should be getting a pap smear at least every 3 years up to 65. This is called screening for cervical cancer. And once you find cervical cancer in an early phase, treatment is much better. And in India, cervical cancer has gone down, but it's still among the top 3 causes of cancer. So we have a long way to go in reducing cervical cancer in India. So pap smear is very, very important. A big question that I get often is HPV vaccination for children. And HPV is human papilloma virus. It's a virus that increases your risk for chronic cervical infections and also your risk for cervical cancer. And now we have a vaccine that can be given to girls and boys starting at age 11 to 12 or before the onset of sexual activity. Uh, I recommend that this vaccine be given to prevent it, especially because India and a lot of other countries, we find a lot of HPV. So if you have a vaccine to prevent it, it prevents against genital warts and also in men, genital warts and anal cancer. So must be given. We have different types of, you have a quadrivalent, 9-valent vaccine. But the key is for HPV vaccination should be offered to people. Switching to colon cancer. Now, colon cancer starts from a small benign polyp, like a pea, and it takes 10 years to go from a pea to a cancer. So it's very easy to catch it along the way. And, either we can check for blood in the stool, or we can do a colonoscopy, which is a much better test where we look at the entire colon through a scope. Nowadays, we also have something called as a virtual colonoscopy. It's not through the computer, but you need to go up and show up for a CT scan. Okay, and that's a CT scan virtual colonoscopy. Now, who should get a colonoscopy? Anybody, men or women more than 50 should get a routine colonoscopy. Now, in the US, you go to your general practitioner at age 50. He says, "Happy birthday, Mr. Pinto. Here's your prescription, for your colonoscopy." And no one fights it. They get it. And that's routine screening. Whereas I see in India, it's very rare, for people to actually go and get a screening colonoscopy at age 50 onwards. So it's very important to get a colonoscopy age 50 onwards every 10 years. Now, another area I see a lot is iron deficiency anemia, or people having a low hemoglobin. One of the biggest causes of iron deficiency anemia is colon cancer. What happens in India is when you get that iron deficiency anemia, and I'm a hematologist, so I also look at anemias. The general practitioner will just treat with iron and fix it and send them home. But no one is seeing why there was blood loss in the first place. And one way to check is a colonoscopy for iron deficiency anemia. So very, very important indication. We also have a screening method for people at high risk for lung cancer. Anyone at the age of 55 and above who have smoked at least a 30-pack here. That means 1 pack a day for 30 years or 2 packs a day for 15 years. And what we do is something called a low-dose CT scan, okay? And that scan is done yearly for 3 years, very low radiation. And it's shown to be much better than just doing a plain X-ray. Actually, most causes for cancer, we don't really look at an X-ray. We find it mostly useless in diagnosing, a cancer. So we would normally push to get a scan, like a CT scan, not to let the men in the room or men online out. They also have a test, called a blood test, called as a PSA test. I know women have to get pap smears, mammograms, and all men have to do is get a blood test. It's not fair. But a blood test at age 50, after discussing the risk with the patient, is called a PSA test, a prostatic specific antigen test, to see if at your risk for prostate cancer. And if it is negative, we recommend it every 2 to 3 years. Okay, so this is a simple blood test that we can do. Now, a big question I get is, Doc, what are the warning signs of cancer? So the first thing I tell most people is that if you see blood either in the stool, in the urine, bleeding from anywhere that's not supposed to be coming out, you need to go see a doctor. It's not normal to just bleed. You must go and see a doctor. Now, if you're losing weight, and unlike me who's trying to lose weight, if you're losing weight and you're not trying to lose weight, that's another thing to see a doctor, because unexplained weight loss, shortness of breath. Now, if you climb 7 flights of stairs and you're short of breath, that's okay. But if you're used to climbing a couple of flights of stairs and you're still short of breath, and that's new, that's another reason to see your doctor. If you're coughing out any blood, and in India, of course, that could mean either ways, TB or cancer, but coughing out blood is another bad sign. Headaches that come first thing in the morning and persistent headaches. Now, I'm not saying that you have an exam that you're studying for, okay? For all, you're giving your final year BCom or you're doing your 12th standard and you've got a tension headache. Oh my God, all this portion to finish. No, that's okay. But if it's persistent headaches, that's another reason, to check with a doctor. Okay. A lot of times, if you have a mole and that mole is changing in size, in shape, or color, that's another thing to look for skin, cancer. So something very, very important that we should look for. So those are kind of the most common, warning signs. A lump or bump anywhere in the body. It's not natural to just have a lump show up. Go check it out. A lot of people wait for, and this is for breast lumps. A lot of people wait and say, you know what, I'll just wait a couple of months and maybe it'll just go away. And then it just becomes larger and huger. So it's very important, moment you feel that lump, to go get it checked out. Okay. Now, what are the lifestyle recommendations? Very, very, very simple. Tobacco is an absolute no-no, and tobacco in any form is just a waste of your life. Okay, because I showed you it's related to cancer, and I'll show you in the future what it's made of and what are the other things it's related to. You have to be active at least 30 minutes a day to maintain a healthy weight. Okay, everybody's trying to maintain a healthy weight. It's tough. It's COVID times. You can't go outside and run and jog. Try at least do the 30 minutes at home. Very, very important. A diet rich in fruits, vegetables, whole grains, low in saturated and trans fats. That means deep fried foods are no. Okay, so you must limit that down. And alcohol. They used to say a drink a day, keeps the doctor away after 50. And now there's new data showing that even a drink a day actually increases your risk for cancer. So I don't want to I don't want to stop the entire party here, but be careful with alcohol use. Protect against sexually transmitted infections, STDs. Wear protection. India, we don't talk a lot about avoiding sun exposure. We think we're born with excellent protection, and we are to a certain degree. But use sunscreen. Wear a hat if you're out. Try to protect your skin from excess exposure to sun. Okay, these are the most common things I would do. Now, whenever I say cancer, people freak out, and then I say chemotherapy, and they're almost passed out in front of me. So, just to explain what is chemotherapy, chemotherapy is a drug that destroys rapidly producing cells. I told you cancer produces rapidly, so this is just a drug that destroys rapidly producing cells. Okay, but the sad part is our blood cells also produce fast. So chemotherapy can have collateral damage and affect our blood cells to a smaller extent. But nowadays, what we've come up with something called as targeted therapies, where we actually block certain mutations only in the cancer cell without affecting normal cells. Okay, these are called targeted therapies, and we're using them across the board. And the advantage is less collateral damage, less side effects, more effective response, and a lot of these targeted medications are just a tablet, like taking a tablet a day. Now, this on the corner is something called smart bomb therapy. I call it a smart bomb therapy. We have chemotherapy actually attached to a monoclonal antibody, and that goes and takes the chemo only to cancer cells. So it's very, very important to only damage cancer cells, not affect surrounding tissue. Disadvantages are cost, and I'm sure that question will come up and we'll address it. Now, here is a patient who's, on a routine, like she was 50 when she came in. She went to just get a plain routine exam, got all the blood tests, and they did a chest x-ray. And they found an immense mass, no symptoms. So directly stage 4 cancer. Here she is with the black, here you see this black mass, this is the tumor. And just 5 months after taking a tablet, because we found a certain mutation called a ROS mutation, she takes a tablet a day and it's gone. Okay, so we have very effective therapies now if we find targets or mutations in the cancer. Now, we all know that whenever we get a cold, right, our body, our immune system fights out a cold. So then why does it not fight cancer? So here's, the T cells that our immune system has, and this is a cancer cell. And, cancer cells are super smart. They bind to these receptors called PD-1 and CTLA-4. And they literally, your own immune system cannot find cancer cells because they're hiding attached to our immune cells. So we have immunotherapies that go and open this bond and actually stimulate your immune system up rather than decrease your immune system to fight the cancer. So they stimulate your immune system. Now, in India, you're considered old, I think, once you hit 60. And that's a very sad thing. Because whenever you're past 60, 65, everybody says, no, he's too old to get anything. But, we give chemotherapy to the elderly. And I've seen, now, for example, I had a gentleman, 80 years. He's the head of a company. He walks around 45 minutes a day. He's probably more active than I am, fitter than me, and looks very young for his age. So I decided to offer him treatment at 80. He's 85, doing well, working Monday to Friday, every day at work. So I think age is just a number. I think what we must look at is what are the other chronic medical conditions, and we can offer chemotherapy all the way into the 80s, even up to 90, if the patient is completely fit and able to. And like I said, a lot of our medicines now are oral tablets or targeted medications. So even those can be offered to these patients. Nowadays, we also look for cancer in blood cells, and in our normal blood, it's called as circulating tumor cells. Currently, we're using this for prognosis of the cancer. In the future, we'll use it for diagnosing cancers. And now, a simple blood test, we can take a simple blood test and see what is the change in mutations in the cancer. So when we give chemo, we know that the cancer mutates and changes itself. Now we can actively monitor what changes are there and target based on that. So our whole treatment is not just a one size fit all. It depends on the cancer. It depends on the patient. We get a whole genome analysis, and we try to target that patient's cancer with a specific targeted drug. That's the whole change of strategy for cancer treatment. The last complicated slide, I promise. Now, everybody's heard of leukemia, right? Blood cancer, and everybody knows leukemia is really bad. If you fail initial treatment, survival is very low, and that's less than 6 months to a year's life. So what they did is they took 30 patients who had failed initial treatment, and some of them failed a bone marrow transplant. All they did is they took their blood, they exposed that blood in the lab. Okay, they took the T cells out. I told you the T cells are our immune cells that help fight infections. They took the T cells out, exposed it to a marker in the tumor, and just put your own blood back in. And it's fascinating. At the end of their study, at 3 years, more than 95% of the patients were in complete remission, no cancer. And some patients had cancer in the brain. Now, the amazing thing is we have now got a third generation CAR T cell available in the US that actually can replicate in your blood. It's like an active drug replicating and goes wherever blood goes, even into the brain. So if people have disease in the brain, it even goes there. So in the future, my bet is, and I'm not a betting guy, is that, we might not even need chemotherapy. We might just be doing CAR T cell therapies. And a lot of trials ongoing for solid tumors like breast, lung, colon at this moment. I put in a slide on COVID and cancer because I think, I thought there was just one big C, and I thought that was cancer until we got the COVID pandemic. And the COVID pandemic, the toll is 50 million cases across the world, 1.2 million deaths, 8.4 million cases in India, 125,000 deaths. I mean, in comparison to cancer in 2018, worldwide, we had only 18 million cases. Of course, we had a lot more deaths, 9.6 million. And in India, we had only 1.1 million cases, but the death rate was much higher at 800,000. So this is another big C. And the problem is when both these big C's come together. Okay, so the thing here is, I think both are very similar. One, COVID and cancer can be prevented. If you have good hand sanitization, you wear a mask, you socially distance, clean surfaces well, right? You prevent COVID. Same thing with cancer. You eat well, don't smoke, don't do no alcohol. You exercise well, do your screenings, and you prevent cancer. And the second common thing I would say is, if you find COVID early, most cases, close to 90%, are asymptomatic. And if you monitor it well, you can figure out when the case becomes, bad and get treated and, do really well. So early picking up, early monitoring, and early treatment, COVID patients do really great. And exactly the same thing with cancer. You pick it up early, you treat it early, and patients do extremely well. I told you, 100% survival, early stage cancer, 25% survival, late stage cancer. So COVID and cancer have very, very similar, things to prevent it. So I want you to keep that in mind too. Now, my last slide is this picture. It's a cigarette you can see here, all right? And you can see what's in it. Toilet cleaner, rocket fuel, lighter fluid, poisons like arsenic. And look at the body. It affects everything, from top to bottom, all cancers. Stomach problems, lung problems, breathing problems, everything is affected, the whole system. Now tell me, would you want to put toilet cleaner to your lips? I mean, come on. So you need to stop smoking today, and this has to be the day that you say, I'm never going to smoke again, because toilet, toilet cleaner on your lips is not doing well, especially when it's causing all those cancers. In summary, quit smoking, moderate your alcohol consumption, have a great healthy diet and exercise, use the appropriate screening, preventative health checkups, and see your doctor immediately if you have any symptoms. Check it out. Don't wait. Check it out. Cancer treatment is really well tolerated nowadays. We have a lot of targeted treatments and immunotherapies, especially for the elderly too. So you must give them a chance to get treated. Okay, and it's more of a personalized approach than before. Now, my contact details are as above. I have a YouTube channel also, so it's Dr. Pinto's Cancer Care, and there's a whole video on this if you want to, look at some of what I've discussed today. And also, my Twitter handle is at Dr. Ian Pinto 1. You're welcome to join there. I normally put updates on any cancer updates, prevention, treatment, any of that comes on that too. Thank you for your time, and I'll be glad to answer any questions.
Yes, sir. We do have questions for both of you. In fact, some of our audience has asked that. So the first question is that CTCL, cutaneous T-cell lymphoma, is known to have no cure. How should these patients look towards their life?
Can you repeat that question again? Sorry. What did you say?
Yes,
What
yes.
is?
Yes, I'll repeat that. CTCL, cutaneous T-cell lymphoma, is known to have
Lymphoma?
no
You mean
cure.
lymphoma?
Lymphoma, right? Sorry,
Yeah. Yeah.
is known to have no cure. How should these patients take to look towards their life?
So I think the first thing to do is to visit. So it's very tough to generalize on a lymphoma, across, just randomly with just a diagnosis. But a T cell lymphoma, we have a lot of new therapeutics, a lot of new chemotherapies. So for each case, you would have to. My number is on the screen still, so you can contact me for an online consultation. We can look at it. But I told you a lot of targeted therapies that attack different receptors. So I would say even for a T cell lymphoma, we have a lot of therapies for that. Lastly, any advanced lymphoma like diffuse large B cell lymphoma, Hodgkin's lymphoma, CAR T cell therapies are also used and can be an effective therapy. Immunotherapies are also used in advanced lymphomas, and these are available to us here.
Okay, okay, sir. Just one more question. Will immunotherapy be a turning point in fighting cancer?
I like to call it the kitchen sink approach, right? Because you throw the entire kitchen sink at the problem, and one thing's going to fix it. And I think each treatment has a certain role and a certain space, and I think immunotherapy has done really well, especially in lung cancers. A lot about in lymphomas, and I'm sure we have to find more ways to stimulate our immune system, to destroy cancer. We've still not reached there yet. I think one of the biggest areas is CAR T cell therapy. And I feel if something could be as easy as that, where we just have to infuse, cells that are reprogrammed, that could be a better, another beautiful approach to treatment. Yeah. But I hope immunotherapy is doing really well, and we're using it here in India. We have at least 5 immunotherapy drugs available, thanks to the companies. A lot of times chemotherapy companies don't come to India because they don't see it as a market where people could afford that therapy. But we've got a lot of therapies now coming to India, and kindly enough, the companies are giving that at a much lower rate than what they would use even in the US or Europe. So it's definitely available for Indians.
Okay, okay. I would like to thank Mahesh Shoshani and Vinny Srivastav for asking these questions. This was really, really important. That is, Doctor, ma'am, that is just great. Everyone who has attended this session has truly gained a lot of knowledge today. The work that you both are doing is just phenomenal, and it was truly insightful, truly. And on behalf of the entire team, I would like to extend our heartfelt gratitude. Sir, ma'am, is there any message or anything in particular that you would like to share with everyone? So you can go first.
I'll let the lady speak first. Go for it.
Okay, okay.
You're on mute. You have to unmute.
Ma'am, you can have the stage. Premi ma'am, Premi ma'am, your mic is on mute.
You'll have to unmute it.
Ma'am, you have to unmute your mic.
Okay. Yeah,
Yes, ma'am.
can you hear
There
me
you
now?
go. Yes,
Yes, ma'am.
I must say I'm really proud of you for organizing this and helping the community and probably saving a few lives, because I think early detection is the best thing you can do. And I'm an example to prove that if you find cancer early, well, life could go on as normal as ever. And I think every child deserves to have his mother with him or her. And it's important for you to protect your mom, which is the whole concept I'm trying to sell. So thank you once again for inviting me. And I'm really proud of the way you put up the show. Thank you so much.
Okay, ma'am. So you can have the stage now.
So I'm going to say thanks from a fellow Rotarian also on the Rotary Club of Bombay. I'm also the chairperson of the cancer committee there, cancer aid committee. Thank you for organizing this. I think this is what we want to do: get this message across to as many people. And thank you for getting this message across to all your students. Definitely, we have to get prevention, which is better than any cure. Thank you for organizing this.
Okay, that is just a splendid thing to say. Thank you so much. Doctor, ma'am, our team is quite keen on meeting you both as soon as possible. We can wait and try to bring another session like this and discuss more of such issues which our world is facing right now. It is people like you who are working every single day to improvise tough times like this. Ma'am, doctor, it was really great having you both with us today. I'm truly grateful. Nothing beats that, and you guys have given us given us so much knowledge. For us as hosts, it was a surreal experience. Thank you so much. Om, is there anything you would like to say to everyone?
Um, I literally have nothing. I mean, thank you so much, both of you, for giving us so much knowledge and helping us understand everything that you've presented us today. Well, just thank you so much for everything.
Okay. Doctor, ma'am, we hope that you felt the same. And today we all are taking a lot of knowledge home. We are already home actually. Okay, well, we'll see you the next time with more such quality content. And until then, people take care and keep shining. Thank you.
Thank you. Thank you.
Thank you.
Thank
Thank you so
you.
much. Bye-bye.
Thank you.
Bye-bye.
Thank you, everyone.
Bye.
Goodbye. Have a great day ahead.
Bye
Bye.
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 Bye-bye. Bye-bye, Arham.
Say thank you.
See you.
Thank you so much, everyone, for this opportunity.
Thank you. Thank you,
Thank you.
Arham.
God bless you all. Bye.